Hi guys, Dr. Traeger here. We have just finished up with our 1 month appointment, or the last appointment after your baby's been gaining weight and over their birth weight. Remember, the purpose of this video is to share it with folks that weren't able to make it to the appointment with you, and also to be able to address some of the things that I want to highlight again, after you guys get home and things like that. Okay, so congratulations. The feeding must be going well because we're over our birth weight and we're moving on up. That's great. That's what we want to see. That is great. So remember, if you're formula feeding, feed the baby as much as it takes. Takes too little, cries more. Takes too much, spits up more. Okay, so, and that's okay. When it comes to spitting up, remember, spitting up is okay as long as it's not bloody or green, and as long as we're overall gaining weight and not like drowning in it and things like that. If there's spitting up concerns, let us know. We'd be happy to talk about it. But most of the time, spitting up is related to taking too much, too quickly, or baby's just really hungry and chugs it down and then gets jostled around and spits it up. But generally, spitting up is okay as long as it's not bloody or green, and as long as we're gaining weight and not, gagging and choking on it all the time. So be aware of that. And then if you're breastfeeding, most moms are feeding about 7 to 12 minutes on each side every couple hours. And the goal is to continue to gain weight at about an ounce a day or so until we see you at your 2-month appointment. So until the 2-month appointment, there's a couple things I really want to highlight. Okay, the first thing is that we need to make sure that we're being healthy and washing our hands and staying away from sick people. We don't want the baby to get sick. That would be a really big deal. And what we consider to be sick, okay, is anything that you're concerned about. True story. If there's something that goes on, baby feels warm to you, baby's not acting right, baby's crying too much, baby's too whatever. We want to hear about all those things, okay? Because the first 2 months of life, something that's going on could be something serious, and we want to hear about it. You're never going to bother us. You're never going to be, or hopefully we're never going to make you feel like, oh my goodness, why'd you waste your time? That's just not the way it goes. But yeah, so let us know if there's any issues. And then at 2 months is when we'll actually give the baby the first set of their vaccines. Now, here's the deal about vaccines. The thing is that these things are very, very safe and they're very, very effective, okay? If there was any doubt in my mind that these things weren't completely safe and effective, I wouldn't give them to my kids, and I definitely wouldn't be giving them to your kids as well. So on the handout that we give you, there's a list of the vaccines that we give and what they're used for and things like that. But generally, when you guys come in, there's 3 vaccines, 3 injections that we get, and then 1 drink. The drink is for this thing called rotavirus, which protects you against this terrible diarrhea, okay? So they get that, and they get that now at 2, 4, and sometimes 6 months. Then they also get their hepatitis B vaccine. Hepatitis is a liver infection that causes liver cancer and things like that. Really big deal. Should have gotten the first dose of that when we were a brand new newborn in the hospital. And then they get that now, and then they get that again at usually 2, 4, and 6 months. Then there's also the pneumonia vaccine. And they get this vaccine at 2, 4, 6, and 12 months. And that protects against the bacteria that causes pneumonia, bloodstream infections, ear infections, sinus infections, things like that. It's actually a really big deal. And then the last one is this thing called the whooping cough vaccine, which also has polio in it, and another vaccine that protects against another type of meningitis. So whooping cough is a big deal. These babies get it, and they cough, and they cough, and they cough, 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 and then they stop breathing. And it's very, very scary stuff. So adults and older kids transmit that thing around. Babies are the ones that get sick and die with it. So that's why we protect them for it. And also from like tetanus and polio, things like that too. So if you have questions about the vaccines, let us know, okay? But generally, after your baby gets their vaccines at 2 months, they'll have a little bump and a lump in their leg, maybe a little more fussy. But generally after that, they are totally cool, nothing to worry about, which is great. But if you have concerns, let us know, and we'll be happy to talk about that more with you, because that's kind of the big deal. Some of you will ask us, they'll say, well, what about, my cousin or so-and-so that doesn't vaccinate? Is it safe for my kid to be around them? And the answer is, you got to do what you got to do. Okay, but for the first 2 months of life, let's just stay away from people as much as we can. Make sure it's just, people that we have to be around, and hand washing and things like that. And, but as they get older, that's something that you and your family are gonna have to address, and we'll be happy to talk with you about that as time goes on. But these vaccines are safe, these things are effective, and that's really great. Okay, so the next time we'll see you guys is at 2 months, and that's when you get your little vaccines and stuff like that. In the meantime, tummy time is important. Let's spend some time on the baby's stomach when they're awake, okay? And then also, a minute or two, many, many times a day is better than one 20 or 30-minute little session. The baby's going to the bathroom is going to change a bunch. They pee all the time, it seems like, and they go to the bathroom, they poop, once a day, 5 times a day, 20 times a day, once every 10 to 20 days. We don't worry about poop unless it's bloody or hard, or it's a problem with them, okay? So bloody or hard, those are big deals. Everything else with pooping is pretty normal. So just leave it alone. It'll go away. It'll come back on its own. Nothing to worry about. And then the last thing about this is that 2 months, the development, and when you guys come in at 2 months, they're going to start smiling at you, looking around at you, things like that. Those are really big things, okay? And you're gonna love it when the baby is 2 months old. Okay, so perfect. Well, keep up the good work, okay? It's hard, it's exhausting. I know you're not sleeping very much right now. You're gonna be awake a lot at night. That's okay. Change the baby, feed the baby, put him down. During the daytime, let's keep waking him up every 2 or 3 hours to try and get him on a little bit of a routine. But the sleeping and stuff does get better with time, okay? And we'll see. We'll see you guys when you guys come in at 2 months, okay? Remember, any questions, please let us know, and keep up the good work. Have a nice day, guys.